Smile. Good morning today, everyone. Today we have an amazing guest with us today on our Frontier Kids Care channel. She is no other than Dr. Joanne Paul. Yay! Now, Joanne, Dr. Paul, I know her since a long time, is super busy because she is the head of the Paediatric Emergency Room and at Mount Hope, Eric Williams Hospital, as well as she's recently been directed to look after more services in all the whole emergency services in the region. So we're really honored to have you today because it's a busy time and we know we really appreciate that. So thank you for coming on.
Thank you very much, Dr. Thomas.
Yes.
Yes.
Today we're going to be discussing really important topic, which is the COVID infections in children. And we're going to touch on a little bit on the MIS-C syndrome that everybody's been hearing about. So without any further ado, over to you, Dr. Paul. Tell us what you know from your extensive experience about COVID in children in Trinidad and Tobago.
So it's interesting though. Thanks, Dr. Thomas. I mean, I just want to push that it's been many years since you've known me. So, mentor, older sister, everything. So,
that's why she said yes, right?
So the interesting thing about COVID-19 and the whole thing in children, a few words come to mind: bimodal, parallel, and it's really not just it's marathon, and of course the fourth word is not just short-sighted but long-sighted. So I'll explain a bit more now.
Good.
So yeah, because it's really, we're gonna see it 360 degrees, both now and long. So we have the bulk of it. So parents will appreciate that most of the time when your child is infected with COVID-19, it will be mild, for sure, mild infections, right? So that's really comforting.
Yes.
But significantly, they're usually asymptomatic. So they weren't around doing normal things you would not know at all. So we've seen lots of children becoming positive. So it's not that they're not positive. We have had lots of them. It's just that they're in homes, and so they are cluster cases, and they're totally mild. So although we've been seeing in the papers lots of big adults, and you think the children have not been affected, they have been infected. Let me just make sure people know that there are COVID-19 infected children. It's just that they are totally well. That's great.
Yes. One second, I want to say this again. You hear that, people? They are totally well, but they are infected. So it's there, it's here. We're just not seeing symptoms generally. Yes? Okay, good.
Yeah. And so we sort of like have to, in the household, I think we have to make sure and protect, let them protect them from the older grandparents. So although we want to have the trick is to have the core family together and still have that barrier. So make sure your children still wash their hands, wear their mask, and watch their distance. So they might be connecting with grandparents via devices, or if they're in the home, just still call them, oh, Granny, how you doing? So they have that connection there. So just be aware, even if they're well, they can still be a risk factor to that grandparent. That's one. But very uncommonly though, but still present, we have severe COVID. And I know we have had that 2-year-old child in newspapers recently. And every so often when we have a child in who's really sick, people go, oh my goodness, children can be. So it's just for us to realize that it's mainly mild, but we have to be still careful and look for the signs of when that could be my child with severe COVID. And the signs are the main systems: brain, neurological. So they will be not quite themselves. They might be talking strippiness. They might see stuff, hallucinate. They might be drowsy, and they're not just quite there. So that's one. The second thing is heart. You'll find their heart is beating really, really fast, and it won't be pumping as well. So therefore, you'll find that their peripheries will be a little bit grayish, a little bit dull and dusky, we call it. So just a little bit down because it's not getting as much blood out and that's the heart. And of course, the third thing, and surprisingly, Dr. Thomas, we have found that in severe MIS-C, the key thing that you will pick up is GI. We have found most of these cases have gastrointestinal systems.
Yes, yes.
Come with diarrhea. So if you've had your child, the first, if we remember anything from this session, is that if your child has been having persistent diarrhea for no reason, no food poisoning, your food tastes good, it wasn't some food you borrowed from somewhere. Yeah.
Nobody's eating outside anyway, so it's home cooked food these days. You can't blame it on the outside food.
Yeah, if it's not any doubles you borrow from somebody and it's good food, you're good. So if it's persistent diarrhea, that's the first thing to look out for. So diarrhea, vomiting, so bowel, heart, and brain are the main three systems involved in severe COVID. And they look sick. And so you think to yourself, it's like, don't be surprised. Whatever, if in this realm your child is looking really sick, most likely severe COVID. So that's the second aspect. And of course, the third aspect, as you mentioned, is MIS-C. So M for multi-system inflammatory is the I. We have the other S, syndrome, and C in children. So really and truly, it just means multiple systems involved. But the difference with the MIS-C is that it's an immune reaction. So they may still be positive or they might be negative in terms of COVID. But they have the same three systems, but they also have the rash. And the rash is really florid. So the rash is what we know, rash of what we call Kawasaki, but it's just a rash in terms of your red eyes. Everything is red and flared. So it's red eyes.
Red eyes,
red tongue. In fact, the tongue looks like a strawberry. Red mouth. The palms are red. The soles are red. The fingertips are like little clots. They have bluish discoloration. And you can't miss it. And typically with MIS-C, it doesn't come without the rash. So they'll have fever and the rash and the other systems which are involved in terms of what you have severe COVID. So again, brain, GI, or gas, or bowel, and also heart. And of course, this case, so aside from the rash, they can still present again with diarrhea. And they have the rash. And typically, the three main systems, the skin, the GI, and also the heart. So the heart will be beating even faster than with severe COVID. And they will be shut down even faster, looking sicker, more sick with the heart issues. Yeah.
So question, which one is more common, the severe COVID, in terms of, we know the most common thing is asymptomatic, right? That's putting that aside. Between the two, the severe COVID and the MIS-C, which one are you seeing more of? And I know we know this, but I just want to reiterate, I noticed in all of them, there are no respiratory symptoms as we have in the adult population. So tell us about that, please.
Yeah, that's a great question. So we have for sure much more MIS-C. In terms of severe COVID, it might be 1% to 2%, but they need to be hospitalized. But in terms of MIS-C, because the significant thing about MIS-C is that it happens 6 to 8 weeks after the infectivity period. And because they're all asymptomatic, they will not have any issues. And then those ones who were asymptomatic now present with MIS-C later on. This is a larger grouping. In terms of respiratory, what they found, which it took us a while to recognize earlier, because everybody was like, oh, your adults are presenting like this. But I think what was the key thing is the immunologists, because they recognized that the whole thing about this COVID was really an immune issue and not a respiratory issue. And the thing is that in children, so the virus comes in and it goes into your body. It goes through the nose and it has nice receptors there. It has to connect though. It's like a lock and key.
Yes.
So it has to stick to something. So it goes where the receptors are. And what they found is that all that goes through the mucous membranes, the nose, etc., we have much more receptors not in the respiratory system for children. So in fact, they found more receptors are in the gut and the bowel. That's why they have those symptomatology. So it would not be respiratory, but significantly though, I don't want us to think, well, not respiratory. Oftentimes when the heart is being affected, they might present breathing faster and having some shortness of breath, only because the heart is trying to work hard. So it's not Wheezing is just the heart that, but no, respiratory not very common at all with children.
Oh, that's good to know.
With COVID, yeah.
That's good to know in that sense. And from what you're saying, both the severe COVID and the missed C are uncommon. So we can call the missed C missed COVID because basically I think you didn't say it maybe when we were talking earlier, it presents a little while after the general symptoms of, people who have had COVID. So tell us a bit about the sequencing of time with missed C and symptoms of COVID in the general population.
Yeah, you can predict it because we had the graph just the same way last year, and I remember presenting this in one of the news conferences. So we had typically, like for instance, we had our first wave in August, September, and in October, November, we had our peak of missed C. So we had a little spike of that. So about 6 to 8 weeks after every wave, you're gonna have an increase. So what I really want to tell parents though, after the surge, because remember last year, we had a few deaths, we had some sick people in hospital, but it wasn't as high as now. With this surge we're having, we're expecting maybe an increase like about 4 times the cases we had last year in that peak. So we had a little blip around July, a very few after our first blip. That blip, I'm not sure it was the first or second wave because it was really imported. Those were cases that came with the cruise ship. And so it's hard to say, but the real wave was in that second wave in August, September. So I'm expecting a lot more. So up to this time, with those 2 peaks, now we've had like a dribble of 1 or 2 in between, but those were the main peaks. We're up to 40 right now, 40 cases in total, 25 who are positive and 50 who are negative. But because our wave is so much higher now, I think we might, if I might predict, I think we might quadruple that amount. So I really want all this uncommon because we're gonna see much more. I want parents to look out for this, but also the sense of power. I want to embolden them with because they might look out for that. And then typically, because we still are a population where we give the responsibility to the doctor and nurse, right? So they might look out for it, recognize, be fully educated, be fully aware, take their child to a health facility. And if we have a doctor there who, or nurse who is less aware than they are, which we're trying not to happen, but if they are less aware and they tell them, oh no, don't worry, I want that parent or guardian to say, no, I have listened to Dr. Thomas, I know my information, I want a senior doctor to review me, I want a second opinion because I think this is missed C and I want my child to be checked out and be seen and observed. So I want us to not just recognize, but be aggressive and have the power to demand a review by our senior doctors because it's your child at the end of the day.
Yeah. Well, that's a great point. So I'm looking at the role of pediatricians in the community and, outside of the hospital system, because I have to say jazzy hands to you all. You're doing such a great job in the hospital. We know it's a multidisciplinary approach because you said you have intensivists, you have emergency room specialists in pediatrics, such as yourself. Then you have your neurologist, your cardiologist, and you have your, we don't have a gastroenterologist per se, but all of these disciplines have to come together to manage these cases. Yeah. So let's have a scenario where a parent would call the office or call, my office or a doctor's office and say, give them the symptoms or what are their concerns, what's their concern right now. Perhaps I see now here a role for telehealth in terms of talking to the parents, seeing them physically, asking them, well, what's the heart rate like? What's the heart beating like? The fingers, what does it look like? Like you can look at the tongue and the symptoms and stuff like that. And so when they're sick, the telehealth, because you really can't come into, the doctor's office per se, but you can be seen virtually, and then we can liaise with the hospital and say, I can call you, I can call up someone else and say, this is what's going on. And there's a direct pipeline in so that there's some information and some process initiated before the patient arrives. So that's one thing. That's one thing that I think can be done. With the mild cases, though, I want to ask you, how is that? Sometimes, you know, you bring patients come into the office with different things. You know, I suppose you saw a case of a child or a teenager with loss of sense of smell or something like that. Generally, what would you advise? Or when you see it in the emergency room, what do you advise? Do you just treat them as if they're a positive case?
Right, you mean, Tim? Yes. So we presume if it smells like a cat, and it looks like a cat, it is a cat, right? So we presume once you've had the symptomatology, you can be swabbed, but it makes more sense to quarantine. So if you're right, if you're doing health and they show the signs and symptoms, it makes more sense to say, here, what, you know, stay at home, have it 21 days, increase your fluids. Now, going back to your point though, with adolescents, they usually present with much more of the GI symptomatology, but they're in between the adults and the child.
Yes.
So, the child will be most of the time asymptomatic. The adolescent though will be symptomatic but with mild symptoms. So they will have the headache, they'll have the diarrhea for sure, the abdominal pain, and their heart, and they'll be feeling extremely lethargic. I mean, intense weakness, much more than the child would. But definitely I recommend, as you mentioned, it doesn't make any sense to swab them because they will be positive, and it's just to have them where you say increase your fluid intake, your paracetamol, and take it eat lots of TLC and stay at home for 21 days. But going back to that first point you made about the Mesido, I think that the private sector and the private doctors have been really stepping up, and they're so like not so much unseen, but they have been really supporting. So although we have the team in the hospital, they're the ones out there who have been doing lots of telemedicine and also doing lots of home visits, etc. And they have providing that support. And in fact, when we had our Miss C last year, they were very aware of all the symptomatology. So the pipeline, as you said, is just that if they see, whether it's WhatsApp or Zoom, etc., do your telemedicine. They call the pediatric emergency, send straight away. Once the patient is there, and we do the testing, and we see that it looked like Miss C, we call the cardiologist, he zooms to right away. We have our neurologist, we also have the intensivist, and they all get together. And we have in fact, the protocol was made in combination with the entire team. So we like the idea of that conduit, that continuation of care from the private sector, who have really done a great job so far. But going back to the original question, yes, definitely if mild, no need to see at all. You just have to presume you are. And I mean, people are like, no, I want to make sure. You don't have to. If you have no sense of taste or smell, and you have those symptoms we suggest, stay at home, drink your fluids, and read a book, and just watch yourself every year. Just do your monitoring, your self-monitoring. Twice a day, check your temperature, check your heart rate, check your oxygen saturations, be aware of your body, and make sure you're not deteriorating. You know, you don't want to be the 1% or so, but check yourself and you should be fine.
So, question then, because of course kids are dependent generally, teens too. So someone tells you that they had a loss of sense of smell 3 weeks ago. So you're now seeing them or hearing about it, and it was 2 weeks ago, or even now. You should say to them, then they should be how do you isolate in a family like that, where by chances are the children or teenagers got it from the parents or other people out because they're not at school? How do you do the dynamics of social isolation, quarantining in a situation like that? Certainly you have to tell the parents they have another, suppose 2 weeks has passed, they have another week in quarantine. Because sometimes they're going out to work and all that sort of thing. They're going out to the grocery and whatnot. So technically they should be in quarantine for 3 weeks. And how do you get to the social distancing within the family when you don't know who was positive? Suppose everyone is asymptomatic or...
Right. So I think what you do is you wait. So you're right. Usually it starts with the adult first, and then they pass on to the child or the adolescent. So if, for instance, the adult are positive, as you suggest that scenario, and now the adolescent or the child is having, the adolescent is having mild symptoms and the child is having no symptoms. The thing is that because we expect that they would not have any issue, you can have your usual wash your hands, etc. But you will presume, because the Brazilian is so infectious, that they will be infected. So you're right. As a child or adolescent, it's really hard to social distance. To me, the protection is really the adults. And so it's not so much the child in terms of that. So you're doing your thing, but the issue is the older adult, the older obese adult, etc. Especially the older one with comorbidities. They're the ones I really want to make a plug for them to be away from the family. So, but still having that social connection. So whether they will be in a separate area per se, when it's the child and the adolescent, my whole thing is not so much about the adult separation from the child from the adult. But just want to make a key thing here that I forgot to mention. Although most children are mild, the key risk factors so far for the ones who will be severe are less than 2 years old. Also obesity. We found a direct correlation, and also uncontrolled diabetes. So for those who are diabetic, make sure that they monitor their child very carefully. But obesity and young age for severe COVID. For MIS-C though, because that was the one, as you mentioned, MIS. That can be any age group, and the common age is about 8 years old, just in between. And that has no connection per se, it could be anybody. But again, a predisposition towards obesity. So I think after this session and after this pandemic, after this surge, I think as parents, we should make more of an effort with our child. Because as you know, if you are an obese child, you now are much more at risk to be an obese adult. So I think that if there's any one point to learn here, is just to make an effort afterwards to make sure our children are fitter, eating healthier, much more exercising outdoors as a normal routine. Yeah.
That's a great question. That's a great answer. Thank you for that. Prevention is so important, and that's where you bring in the pediatricians on the outside, because you guys more or less just see someone when they come in sick, but we are at the other end where we can make the difference in terms of health and learning and stuff like that, parenting. Now, question, if they're at home, should they be wearing a mask? Certainly with interaction with grandparents and extended family, yes.
Yeah, definitely. So I think the key thing, because realistically, if I have a mask on, because again, you're wearing it, right? You're wearing the whole thing. If I'm a child, and I have a mask on all the time, obviously, I'll rip it off, right? And it would be, well, have it wet, it would make no sense. So what you do is you teach a child, here what, when you go with grandparents, or as you mentioned, other persons, wear your mask. And if I'm a child and I can do it intermittently, I'll tolerate it more. So therefore, but make sure I keep my hands washed, have my mask on, and I'm not so like just pulling it up and shouting and singing. So just be aware. Tell the children, don't push, because they have to understand that it's spread via that whole thing, but in the air. So once you stop that, then it's reduced. But a little caveat though, because the children have less respiratory receptors, they transmit less. So
nice.
that, we want to make sure they do their things in the household. Their transmission from child to adult is much less. So once they're washing their hands and they have their mask on, at least some of the time, it's pretty okay. I think the nervousness about school.
Yes, that's a big question though.
Yeah, it's a comparison. So what they found is that you're definitely it's all about numbers. So if I have 100 adults and I have 100 children, the 100 adults will be much more infectious for sure than 100 children.
Right.
But the thing about school, I now have much more children. So in comparison, you will have much more infectivity in schools. So having children in schools is a definite risk factor, because although they transmit less, for sure, like I think it's less than half than the adults, because they have much less receptors there.
Yes.
So they're less infected. The fact is that they will infect each other in schools. So my thing about that is to be practical. Again,
risk benefit. The risk and the benefit, yes, everything.
Exactly. So it's you're in your home and you have your sorry comes and you have to decide what goes towards where. The same thing about this, right? two things. One, I think that if we can vaccinate our adults in the
Yes.
school,
Yes.
therefore the children can infect each other, right? But when they come home or when they're in school, they won't infect the adults. That's the whole thing. That's number one.
Yes.
And number two, that's why I spoke about short-sighted and long-sighted. I think we're not aware per se, but because we're involved in the pandemic and we're scared, etc., but we're not seeing the after effects. We have to look long-sighted.
Yes.
Of that online, not just educational, Dr. Thomas. Oh my goodness. We're seeing it, but we're not seeing it. And when you hear the mental health experts talk about it, they speak about, like I spoke to Prof. Hutchison, and he spoke about the fact that this will last for a year or 2 or 3 or 4 or 5. And when we see patients coming in, so for a while, we had a lot of them coming in with cutting. They were having loss reaction, the anxiety. They had attempted suicide. So although we're focused on Miss C, I want us to understand that school is a really important educational, social, everything for our children, especially adolescents, because they see their peers as their rock. The most important thing to them in that age group is their peers. They're not seeing their peers. And I mean, there's online connection, but we're losing that. And so we have to go back to school, like have to. And so it's like having steps. Vaccinate so we can go back to school. And in school, if we have the entire class, and being a bit cavalier here, I don't mind if the entire class gets infected, as long as nobody's seriously ill and the adults are fine, and as long as the children don't have the mental health aspect. So we've lost so much educationally. Lots of children have been going to the cracks. We have lost, so there's lots of parallel effects. So we have the educational, we have the mental health aspect, we have the screen time. But they switch now. So what you find is that the boys aren't doing well in school, but they're doing well on Fortnite. So there'll be all the online games and everything is online and etc. But we've pulled away. Interestingly enough, we've also done it's isolating. So although at home, because there's no school and everybody's just not lull a holding pattern, the children are doing their stuff here, the adolescents in their rooms doing just on playing their games. We don't have as much of that family. And so there's this massive ripple effect of so many parallel pandemics from this pandemic. I think I want us to appreciate the 360 degrees and see all of them. So there's also safety. So for me, it's a safety in the home. It's the online, it's the educational, it's the mental health, and it's the screen time. And the last thing, which even goes further, is the long COVID. And so we're seeing that in adults, but they're seeing, although the children are having less of it, with the MIS-C and with the severe COVID, we're going to have long COVID with children, where they're lethargic. It's almost like the chronic fatigue syndrome, and it's going to last for about 6 months to a year. So I just need to have us look at everything, see and see at that point in time which one is better for our children, but also as parents in homes and also as private pediatricians, understand that your role could be at that base, that whole core of online time mental health, because I think it might be where you connect with families, even have a not just a telehealth with the child and the parent, but the entire family. Get them on how to connect to be a family during this time.
Yes, absolutely. And that's what we do, because we've been seeing a lot of fallout with all those things you said. I'm seeing lots of depressed teenagers, lots and lots and lots. Children who are doing exams and the exams unhinged. And, I'm seeing the screen time issues, the children putting on a lot of weight. And something we're not really looking at was the parents who are absolutely overwhelmed, especially the mothers. The mothers are teaching at home and being parents and teachers and nurses. They're doing everything, and it's causing some fragile families can fall through the cracks for sure. And I'm seeing that quite a bit. So it's important to connect with your pediatrician, connect with the health centers, wherever it is that help can be had, and to be aware and to be, you know, as you said, very intentional about knowing what the risks are, knowing the risk benefits, talking about getting the adults vaccinated. Hopefully we can overcome that hurdle, because that's a hurdle. A lot of grandparents tell me they don't really want to get the vaccine, but you have to speak to them, even though it's the child, you're dealing with the whole extended family really, and getting them to take the vaccine, because most of them surprisingly have comorbid problems and they're still not taking the vaccine. So this information was gold. It was liquid gold. And I really thank you for coming on today and taking the time out of your busy schedule to tell us about this and to educate us and to reassure us also, because you've been very reassuring that generally kids are well, just a very small percentage that do get sick with either the COVID, severe COVID, or the MIS-C, and that the kids do spread, but not as much as the adults. And that all in all, once we know what we're up to, we can work through this thing together. So Dr. Paul, thank you, thank you, thank you. Thank you to all those health workers out there, the pediatricians and nurses, the doctors, everyone who is looking after this country, this nation, while we get through this thing together. Thank you from the bottom of my heart, okay?
Thank you, Dr. Thomas. Just one last comment. And see me how you were thanking everybody. I just want to ask those parents out there in the community, aside from the intentional family togetherness, I think they have to also remember the orphans. We've had a good few
yes.
families who have lost both parents, etc.
Yes.
Or even lost a parent, because we have the fallout, not just as you mentioned about the parents who are totally overwhelmed, but then we have the ones who did not make it. So condolences to them, but also to have all of us, I think this is a time to really connect with each other, because we have a good few teenagers out there who would have lost their parents, a few children out there, and they would need our support even more.
Absolutely. Yeah. Oh gosh, that's a great point. Thank you for that. Thank you for that. Yeah. So we've got our work to do, but I think we're up to it. So take care and bye for now. And thank you, thank you, thank you.